Welcome to M&A Power and Practice, the podcast for all things M&A. This podcast is a tool for education, information, and making your collective voice heard as members of the Minnesota Nurses Association. Our third episode is on M&A's Concern for Safe Staffing form. I'm your host today, M&A staff member Lauren Nielsen, joined today by Carrie Mortrude, M&A's nurse staffing specialist. Welcome, Carrie. Why don't you introduce yourself?
Good afternoon, Lauren, and hello, everyone. My name's Carrie Mortrude, and I am the nurse staffing specialist for the Minnesota Nurses Association. And what that means is I deal with all things staffing here for the organization and for all of our members.
Great. Well, welcome again. So today we're going to start off with a couple more general questions and talking a little bit about what is the Concern for Safe Staffing form and where did it originate?
So the Concern for Safe Staffing form is a tool for our members to collect data and information when the nurse, in his or her judgment, professional judgment, believes that patient safety is at risk because there isn't the right trained staff, the right number of staff, the right skill mix of staff, or any of those combinations. So it's a way for our members to collect that information and submit it to us for analyzation, utilization, just looking through to see if we can find trends, etc. So it is our way to capture those instances when patient safety might be at risk because staffing is short and unsafe. It originated back, I think, in the early 90s, and it was a way for our members to actually track data and information regarding their shift. So it was really more nurse-centric, and it collected whether or not the nurses got their break or how many patients they were assigned and whether or not they had to do overtime. But what we learned over time is that the legislature, the employer, a lot of other decision makers really care about the patient experience and patient safety. And so we changed the form to really collect a little bit more data that was related to being patient-centric, not as much nurse-centric. So we still do collect the nursing part of it, the nurse side of it, but we really focus on the patient experience and how short staffing, unsafe staffing impacts patients. So the form itself has been around, or some form of the form has been around for over 30 years now. But we have adjusted it, changed it. As we all know, healthcare has changed. The environment in the hospital has changed. The invention of the electronic medical record and how technology just moves so fast. The patients are in the hospital a shorter amount of time, but the cares that they are receiving is at such an advanced level that turnover happens quickly with patients, etc. So it's really important that we capture anything that might impact the patient in a negative way, especially where the nurse is involved.
Definitely. Thanks for sharing some of that background. So for maybe some of our newer members or those who aren't as familiar with the Concern for Safe Staffing form or could just use a little refresher, why is it important? What are the most important things to know about the Concern for Safe Staffing form? Why is it important for nurses to fill out?
Obviously, nurses chart in the patient chart about the patient experience and their progress or even setbacks that they might have in their care. But there's a lot of other information that the Concern for Safe Staffing form can capture regarding the nurse's ability to deliver care in a timely fashion and safely. And so it's really important to file the Concern for Safe Staffing form at any time when the nurse feels that patient safety is and has been at risk, even if, when a negative outcome has actually occurred, But even if it hasn't occurred, because according to the Nurse Practice Act, nurses are responsible to deliver safe care and can be held accountable for delivering unsafe care, even if nothing bad happens to the patient. So a negative outcome doesn't even have to occur. But if the nurse was found to have put a patient at risk, that is still a reportable instance to the Board of Nursing. And so even if nothing bad happens, if serious unsafe staffing is occurring, it is important to file the form, fill it out. You don't have to fill it out on that shift. You don't have to fill it out at the beginning. You can do it, sitting in your car, waiting for your car to cool down during the summer or warm up during the winter times, right? Especially here in Minnesota. Or you can fill it out later on in the week. It's just important to make sure that you capture the data when it's fresh in your mind. Now, we want to make sure that there's no patient identifying information. We don't want any HIPAA violations or anything that would put a nurse at risk. But the form is very prescriptive and really prompts you all the way through the process. And so it's important to fill out the form when the experience is fresh in your mind and you have that access readily for you to fill it out. But honestly, you don't have to fill it out until, you have the time to do so. It also helps your local elected stewards and M&A chairpersons at your local level if there's a meeting around staffing to have that data. And so if the form's not filled out, it really doesn't help your leaders or you even have a discussion about the incident without that data recorded.
Right. Yes, those are all things to keep in mind, especially around, you don't have to fill out the form right away. You can do it when you have the time to, as long as it's still, fresh information in your mind. I think that's probably one of the biggest misconceptions about the Concern for Safe Staffing form that I've heard of, is not knowing, do I have to fill this out right away, or can I fill it out after my shift, and so on. So related to that, could you share a little bit about what are some of the top reasons that nurses don't fill out the form?
Honestly, Lauren, I completely understand and appreciate that there's this phenomenon of form fatigue. Nurses are done and over it, especially with all the kinds of documentation that are required, including hand washing and education and your own education as well as the patient education and maybe other coworkers you work with and all of these checklists and all of these forms and documentation, right? Nurses learn in school, if it wasn't documented, it wasn't done or it never happened, right? So it is so critical to document, and this form is no different. If we don't compile this information, it's very easy for the hospital to just say, well, there is no problem, right? Literally, if there's no documentation and a patient doesn't suffer some incredible, awful event, then the hospital just kind of gets away with everything's fine, right? Because there's nothing to dispute that. And we know that that can also lead to just hopelessness, right? If nurses want not immediate change, but part of a nurse's job is to get a patient ready, even on the first day of admission, get that patient ready for discharge. And so you start the discharge process on the day that they're admitted. And if you are one to consistently fill out the Concern for Safe Staffing form each and every time that staffing is short, yet 6 months later, a year later, you're still experiencing short staffing, you may not want to fill out the form anymore because you just don't understand and you're not seeing that return on investment. If you filled out the form and the next day 3 more nurses were hired, that'd be amazing, right? And you'd be like, okay, I'm going to fill this out. But if you're like me, I experience short staffing day after day, shift after shift, month after month, and unfortunately year after year. In the intro, I probably could have explained a little bit more about my own experience, but I left the bedside because of short staffing. And so I was a nurse at one of the metro major hospitals here for a long time in the cardiac telemetry and cardiac ICU area. And I went to the cardiac ICU because staffing was so rough on the tele units. And I tell the story in the responding to unsafe assignment classes that a normal assignment on nights for me on the tele floor was about 1 to 7, 1 to 8 might have been pushing it a little bit. But one night I was assigned 12 patients. And so I didn't know any better at the time. So of course I just accepted it and did the best that I can. But I can tell you that at no point during that shift was I actually advancing the patient's plan of care. I was just trying to make sure everyone was safe, pass any medications that might have been due at midnight or at 6 a.m., and just charting the best I could. But there was no discharge teaching or planning going on, no therapeutic therapies or communication, because I just didn't have time to do that many cares for that many patients in one shift.
Right.
So like I said, I went to the ICU, and then I experienced another situation where I was being brought another patient. We even physically didn't have space in the ICU suite I was in, but because the surgical services were turning out patients so quickly that day, they were just going to start bringing them. And I was told to put a post-op open heart patient in a wheelchair with a telepack in the hallway. And knowing full well that I would still be responsible for that patient, even though this person was in the hallway and I was getting another patient that was in the ICU, that was just unacceptable. And it wasn't something I could participate in. We eventually resolved that situation, but it was really an eye-opener to me that we have to do something different with staffing, because the most critical thing a nurse has to give a patient is his or her time. Time to do assessments, time to do cares, time to do teaching, all of those things. And when we get cut short on time and cut corners, that's when mistakes happen and unfortunately negative events. And so I understand the hopelessness and the form fatigue, but I just have to stress that if we don't have the data and we don't have the information, nothing's going to change. And we know that the more we collect it, the more we have data to prove that there is a problem and a connection, and the more research that's done out there that shows that infection rates and falls and missed opportunities, or near misses they call them in the hospital, more of those occur if there's not enough nurses that are properly trained for that type of patient and the amount of time that they have to care for them. It's just going to continue to deteriorate.
Right. Yes. Thank you for sharing your own personal experiences.
Absolutely.
I think it's important for nurses to hear from fellow RNs about some of their experiences as well when filling out these forms and trying to make change for the better for their patients. Could you maybe share another example or two of instances when when it might be important for a nurse to fill out a concern for safe staffing form?
Absolutely. So when we teach classes, when we offer the classes and, either do them here in the M&A office and or we go out into the state and show up at a bargaining unit and teach classes, we have shared stories that nurses have called us to tell us how important it was that they had filed the concern for safe staffing form and had that available to them when they were investigated. So management called them in and said, there's these issues with your charting, or this patient fell, or there's this patient complaint, or this whatever it is situation that occurred. When management calls the nurse in for an investigatory meeting, nurses have actually brought with a copy of the concern for safe staffing form that they filled out to, one, jog their memory, but also prove the notification that, look, we filed this form and we do protect the nurse insofar as You don't have to submit that form directly to management, but on the form, it requires you to fill out who you notified, because we do have to give the employer the opportunity to fix the situation when there's a problem. We can't just say, well, there was no one here, it was the weekend or the holiday, and I'll let them know on Monday. That doesn't do you, your colleagues, or the patients any good on Friday night at midnight if you wait until Monday to let management know that there's a problem. So the form prompts you to make sure that you contact management. And then we have gone on to teach about calling up the chain of command and the policies that many hospitals have regarding that. But nurses have expressed to us how important it was and how thankful they were that they had filled out the form and submitted it, because it was a way for them to use for their, you could say, defense. And in fact, we did have a nurse share with us that unfortunately he was involved in a malpractice case, but once he showed the documentation to the judge of everything that he had done to advocate for his patient, the judge then released him from that case, because he indeed had done everything in his power to notify management, to advocate for the patient, and to protect his license. And so, like I said, I think it's almost limitless when you think about the things a nurse needs to do to protect her license, which then in turn protects the patients. Actually, filling out this form is one of the most critical. And we know that many hospitals have an incident form, or it's called a PVSR, so Patient Visitor Safety Report. That is a policy the hospital requires you to fill out if there's a medication error or a patient fall. And so we know that those have to be filled out as well. But you should also then go ahead and fill out the Concern for Safe Staffing form. That is M&A's form, because M&A doesn't get a copy of that incident report. That is required by the hospital. And we know that that gets compiled with all the other incident reports and really only gets reported to regulatory agencies as aggregate data. So there's not a whole lot of follow-up afterwards to let nurses know, oh, X nurse raised this issue, this was the problem, so therefore we have now changed this practice to show this in order to provide better safety. That usually never happens. And so we really need to protect the integrity of this form and continue to use it over and over and over again, so that the nurse's side of the story is always present and always told.
Great. Yeah, those are great examples. So you've mentioned a couple things here and there already, but can you go a little more in depth about what happens to the information once a form is submitted?
Absolutely. So when the nurse submits the completed form, and you don't have to complete every single section or checkbox or free form area. And it's funny that we go through phases with different groups as new nurses come in or there's turnover. A group may say to me, I really want more space to write out the story about how the night went. And there's no problem with that. But we also want to make sure that the form is as easy as possible to fill out. And that's why we went to the checkbox system, is so that nurses could just quickly go through and check those boxes of specific instances that keep occurring over and over again. But if there's more to the story, there's no reason why you couldn't, one, send me an email or send your unit steward or your chairs at your hospital an email to explain further, and then I will also get that. But when you submit the form, there is a list of union stewards, chairs, and then myself who are automatically sent a copy. And so once that gets submitted, some of you may notice at the end or when you go to fill one out that it also gives you the opportunity to notify your elected official. So that is an option as well. And that has been very helpful as we try to move legislation forward, that nurses have that option, and they have been using that to express how critical staffing is And when it's short and unsafe, how it impacts patients, it's a direct connection for the constituent to get a hold of their legislator. It will come to me. I currently think I have over 500 in my inbox that I am sorting into different bargaining units. But one of the points we wanted to bring up, Lauren, and talk about is that the amount of forms that we continue to see and how they increase. And so last year in 2021, we had over 7,800 that were submitted. And so we at the office, so Lily is my administrative assistant and is the data guru, if you want, when it comes to concern for safe staffing. And so she works with the Access database and can pull any kind of data that any nurse wants. If there is a staffing advisory committee going on at your hospital, or a unit labor management or a house-wide labor management meeting coming up, and you would like to talk about specific trends in, let's say, labor and delivery at your hospital, Lily can pull that specific information. And if there's any glitches in it, her and I will talk and we will figure out, what might be the problem, or why aren't we getting this? And we can work that out and provide that to you. We just need a little bit of a heads up because it can be a little tricky sometimes to pull specific data, but it really is user friendly, and it's data that we collect for you to use to make things better at your hospital and be able to tell your story sort of in real time, right? It's not that we get it and at 11 o'clock on a Friday night, we could say, hey, you're down 7 nurses across the entire state, but it is something that we can compile and look at quarter to quarter, month to month, however you guys want to use it and see fit. So it is a great tool. And I know it's underutilized, and I also know that the form is not filled out as often as possible. Every time I have a class, I ask the question, have you filled the form out? Most people raise their hand, but then when I ask the follow-up question, do you fill it out every single time staffing is unsafe or short? Most of the time people say no. And I totally understand why. It's the form fatigue, the hopelessness, the things don't change. But if we don't have the data, then we can't prove how important staffing is. And so it's just one of those things that if you can just add that one more thing to your list. And again, I never want the form to be a barrier to filling it out. And so if you need to wait a couple days, if you need to wait a month, you can still fill out the form. It just is better if you can fill it out closer to the time of the event that it occurred, and also in a timely form so your leadership at your hospital can use it to advocate for you and your unit.
Right. Yeah, that's great how many ways that all of that data and information can be used, and how members can use it to help them and to help provide better patient care and to move things forward at the legislature and all those different channels. It's really great to know about where that information goes. So with that data, I know you mentioned how many forms have come in through the past year. Have you seen any changes in the data throughout the years? What are some of those standout things that you've noticed as you've seen things progress throughout the years with these forms?
Yeah, that's an excellent question, Lauren. And as we have seen the amount of forms filed increase, what's interesting is over the last 7 to 8 years, the top 4 to 5 incidents that are getting reported remain the same in their quantity. Like I said at the beginning, we have kind of changed the form and molded it to meet the needs as the nursing environment change and patient care changes and hospitals throughput changes, all of those things. So we just keep adding different things that are impacting patient care and the nurse's ability to deliver safe care. And unfortunately, a couple of years ago, as we saw workplace violence increase, we added specific targets related to that What are we seeing related to safe staffing? Because we all know that the more time a nurse can spend with someone who's agitated or upset, and even dementia or Alzheimer's, whatever it is, the more time a nurse can spend with that patient, the less likely, it's not 100%, but the less likely an outburst or incident may happen. It's when patients get frustrated or families get frustrated with wait times and not getting answers, not getting call lights answered, those kinds of things, and patients that get confused in the middle of the night who don't remember they're supposed to call for help, right? They get up in the middle of the night, take themselves to the bathroom, and they fall, right? Because they're not supposed to be up by themselves. We keep adding to that list, but what has remained consistent is that the lack of management responding to that call, or them responding with something that is not helpful, has remained the number one most reported incident out of all of the concern for safe staffing forms that are submitted. So, you know, like I said, since we started tracking this specific way with the online form the last 7 to 8 years, that has remained the number one most reported unfortunate incident in this whole situation. And then following closely after is delays in medications, delays in getting call lights answered, and delays in cares. Those are the top 4 every single year. And that, to me, just shows a picture that when the hospitals, either during negotiations or even at the legislature, claim that all nurses have to do is ask for help when they need it, this clearly demonstrates that nurses ask and they either don't even get a phone call back, or the response is, well, we're going to get you pizza tonight, or we got you a meal voucher, or we know you asked for a registered nurse, but all we have is a nursing assistant, so we're going to send you a nursing assistant. None of those are acceptable. When a nurse in her professional judgment is requesting 2 additional RNs because of patient acuity and nursing intensity, that's what they need. Not pizza, and not another skill mix of a healthcare professional. We are all part of a team, but a nurse knows what a patient assignment needs, and when they call and ask for it and they're either not called back or told they have to just suck it up or pray nobody comes in because there's no other beds and no other staff, that's unacceptable.
Definitely unacceptable. Thank you for sharing a little bit more about that data. When a nurse fills out the concern for safe staffing form, or when a nurse wants to fill out a concern for safe staffing form, where do they go? How do they access the form? What's that process like?
We've tried to make this simple as well. You may notice that some of your colleagues or you yourself have a button that just has a QR code on it. Or you might have the little accordion card that looks like a little business card that opens up into, 14 different little paragraphs. And on that card, there's a section that has the QR code. On the M&A website, you can go to the M&A website and click in the corner where it says report unsafe staffing or concern for safe staffing. So there's multiple ways that you can do this. With the QR code, obviously, you just turn your camera on your phone, hold it over, hover it over the QR code, and immediately the form will pop up. And so you can fill it out while you're sitting in your car on your phone. You can wait till you get home and go to the website. There's multiple ways that you can fill out the form. And so we really encourage you to do that. If you guys have new ideas and there's new technology that comes out, we're always happy to hear that, but we do want to keep it as simple for all generations to fill out. And if you don't, those aren't working for you, just ask a colleague or ask your steward or a chair. They'd be happy to help you figure it out. What we don't want is sometimes the archaic old paper form will actually get mailed to the M&A office, and that is nearly impossible for us to add to the current data. And so if you have one of those, if you have a stockpile of them, please use them to start your bonfire for your s'mores this weekend. Do that instead, but please use the electronic form because it's so much easier to compile data, sort data, look at trends, and all those kinds of things that are important for us to use to talk about staffing that way. So those are the ways that you can fill out the form. And again, if you have other ideas or ways that you think we can use these, we're always open to that. And it's a good question too, because sometimes nurses want to know, like, how does this form get changed, or what's the process if we need something different, or, those kinds of things. So the Nursing Practice and Education Commission is the commission that sort of owns the form or the data, but changes then go through them for review, and then they make a recommendation to the Collective Bargaining Committee, it's called, so the CBC, which is another committee off of the M&A board. And so any changes, concerns, thoughts about the form could come to the Nursing Practice and Education Commission for consideration, and then they make the recommendation to the CBC or the Collective Bargaining Committee, and then they approve those. And then I would work with Lily and our outside company that creates the data or creates the form for us and the website. And so all of that can be done. Again, we just need a little leeway and a little timing, because we want each 12 months to be the same. So any changes really could come in August or September and give us some time to go through those committees. And then the changes wouldn't go live until January 1st, so that each year stays consistent with what we're collecting, so that we're not changing the year or changing the form mid-year,
right.
et cetera, that kind of stuff.
Yeah. That makes sense. Great. Is there anything else that you'd like to highlight about Concern for Safe Staffing, or any other resources that members should know about?
I think the last piece that I just want to share or plug is that, we have the Concern for Safe Responding to Unsafe Assignment classes, as well as the Nurse Practice Act class, where we talk about this form and the importance of the form, and are open to feedback, criticism, any kind of question or confusion we can talk about there. So please think about that when you come to class. If there's a specific situation you want to talk about in relation to pushback you got when filling out the form, or how you can use it to help you, or have conversations with other members, just remember that the form itself is our way to collect data post-incident, right? I wish that filling out the form would magically make a nurse appear, right? But it doesn't work that way. And so it's critical that nurses alert management to the unsafe, serious, short staffing situation and put them on notice. We are letting you know this is the situation, this is why it's unsafe, and this is what we need. If you know what you need to make it safer, please advocate for that. Tell them what you need. If you come to the table with a solution, sometimes you're able to get a result that you need. And so if you know exactly what you need, what would make it safe, then mention that, bring it up, ask for it. But don't forget to fill out the form afterwards, because again, even if someone says, a supervisor says to you, hey, the shift before you had much less safe staffing, right? They had fewer nurses, they were down 4, you're only down 2. How can you say that this shift is going to be unsafe when nothing bad happened to them on their shift? Again, the key is that if a nurse accepts an assignment that they know they cannot safely care for, you can be held accountable for that. And so it's really critical to call up the chain of command, alert management, but then afterwards fill out the Concern for Safe Staffing form as your way to track what you did, how you advocated for your patients, and how you advocated to protect your license.
Thank you for those reminders. And folks, remember, you can check out the Concern for Safe Staffing form and fill it out anytime on the M&A website. That's mnnurses.org. You can also go to that website and look at what upcoming classes, including the Responding to Unsafe Assignments class, when those are coming up and how to sign up for those. It's all on the website. So I think we'll wrap up here for today. Thank you again, Carrie, for joining us to talk about Concern for Safe Staffing forms, and have a great day.
Thanks, everybody.
Thanks for listening to M&A Power in Practice. Be sure to subscribe to the podcast through your favorite streaming service so that you don't miss a single episode. Want to get in touch? Email power.practice@mnnurses.org for more information.